Charlie April says you never think about the sacroiliac joint if you don't think about the sacroiliac joint.
We are convinced and we are really educated, but what happened when every spine surgeon in the world started to perform SI joint fusion? I don't know.
The first International Congress on Sacroiliac Joint Surgery in Hamburg was a true update on sacroiliac joint surgery, treatment, research and medical device developments. 17 national and international experts met with a highly qualified auditorium to share and discuss their experience and actual knowledge.
Voluntary kind of recommended to all the physicians. Do you worry about data picking?
The Sacroiliac Medical Expert Group, a non-profit medical association for research into SI joint diseases and treatment, set up an unbiased conference which was not dictated by commercial interest.
And I'd like to start off by thanking Volker and Mr. Dirks for inviting me and for putting on this meeting, and not only for putting on the meeting, but to make it as commercial-free as possible, which is a bit of a breath of fresh air.
Everyone was dedicated to serious research, and all the discussions, though controversial, always tried to find a consensus for the most important questions.
You have to have a CT scan positive or not?
Not necessarily.
An MRI positive or not?
Not necessarily.
An injection positive or not?
Not necessarily. It depends. You know, you build a case. You build a case and you have to look at
but you cannot build a case on
individually.
And how many Leslie tests you need positives?
I'm not using all the Leslie tests.
So I think, it would be nice if out of this discussion, we formulate a way to really answer some of these questions.
It became clear that all these experts had been going their own way in the past, driven by their patients to find solutions to their individual pain, and it was only natural that their ways did not lead to Roma, but to the conference in Hamburg to start a mutual research into the surgical aspects of sacroiliac joint pain treatment.
Yeah, but you should come with a positive argument before you go into surgery.
And what if there is no positive argument? The sacroiliac joint is the last example of osteoarthritis in the body.
The introducing words of organizer Michael Dirks and President Dr. Volker Fuchs served as guidelines to lead through the discussions.
And if you attend this meeting as a company representative, to learn about commercial aspects. This will help you to avoid failed investments, and it will help the attending surgeons to avoid failed diagnosis and treatment.
I would have never thought that I would stand here today in front of you and have the honor to open the first international conference on surgical treatment of the sacroiliac joint. And the more I saw how difficult it was even for experienced spine surgeons to understand the SI joint anatomy, the more questions came to my mind. I am completely in line with Professor Heine, who formulated it to the point in 2013. Hopefully, the increasing numbers of reports on the treatment for SI joint problems will not misguide us surgeons to perform uncontrolled interventions, and I wish we do not have to state that too many SI joints are damaged by surgeons for undefined pain problems.
Basic sacroiliac joint presentations about historical and actual treatments and their risks and benefits, innovation of the sacroiliac joint, SPECT CT and special MRI diagnostic imaging techniques, the innovation challenges, and conservative treatment, as well as physical diagnostic tests, were the topics which nourished their hungry audience with solid science. The well-renowned rheumatologist Professor Sieper from the Charité Hospital in Berlin, Germany, presented his experience about diagnosis and treatment of sacroiliitis. And he agreed with Dr. Fuchs to even consider the non-responding patients to be operated on.
And I have no idea what role surgery could play there. Problem is that probably not so many patients around, but I think this, get accepted, you have to show that it's have an effect.
But that's why we have to work together, that you send us the non-responders.
An open question, which I didn't hear an answer to, is whether or not there's a disadvantage to fusing the sacroiliac joint. And I know at least...
I don't know.
And I don't either. And
so might be we work together.
Yeah,
so
no problem. Well, we have to find the patient, but yes.
At the end of day one, Dr. Fuchs started a roundtable discussion about diagnostic algorithm and tried to find answers to his questions. At what point of time do we speak of chronic sacroiliac joint pain? How many months of intensive conservative treatment do we demand before sacroiliac joint fusion? What in- and exclusion criteria should we recommend for sacroiliac joint surgery? Should we use a pain diagram? Do we need a control block? Should we use extra-articular injection? At what time should we evaluate the patient's pain level after the infiltration? What percentage of pain reduction after the infiltration do we demand defining a positive result?
Minimum. That we just recommend a minimum time of pain and a minimum time of conservative
It became obvious that not all of these questions could be bindingly answered during this conference, since almost each of the participants had her or his own experience and algorithm, understanding and view on these answers.
Tear on the side of the sacroiliac joint.
I wouldn't go this.
1 year is not. You have time to wait for a year, I think. You started this brainstorming here now and putting a lot of ideas up. Which outcome should we use, and at what time should we do the surgery? And you find the main questions. And you run a Delphi process when you find expert groups and you're sending the questionnaire around and you're collecting them. And you will have a really good recommendation that is easier to spread around the world. And you will be more acknowledged. But it will take time.
Saturday was dominated by the presentation and discussion of known surgical techniques.
And the only thing that really seems to work is restoring the anatomy.
Different from other conferences, the presentations included only very few case reports to demonstrate the pros and cons of the various methods in a very fair and scientific way.
The fascia between the superficial and the deep fascias in the lumbar spine.
There's one remarkable thing happening here. This is your first international congress on the SI joint, and in the first congress we hear something about registries. This is remarkable.
100% satisfaction, 100% I would certainly have done it again, no complication at all. So, is it too good to be true?
Surgery or not, and I like this one. If this doesn't help, you can come back and you may get something else. Why couldn't I have something else right now?
Compression test, distraction test, Faber test, go on.
Do you think it's the diagnostic criteria that is not good enough, or is it the surgery that is not good enough?
We had Olympics in Lillehammer in 1994, and then the president said, the best Olympics ever, and I will say to you, this is the best Congress ever I've been to. So thank you.
Thank you.
And on behalf of our whole research team, we'd like to thank SIMEG for the opportunity to participate in the conference.
I want to say, Dr. Volker, vielen Dank für die Organisation und die Einladung zu dieser Konferenz.
So, and once again, a lot of thanks to Dr. Fuchs to set up such a society, which is extremely important. I wish you all the best for the future. Thank you very much.
Thank you.
Where do you want to go from here? I do not have the answer. Volker?
I want to set up a new program, an interesting program, of course. I hope I can make it together with Michael, together with Thomas, and everybody else who wants to join me and to help me about this, and the industry, of course. And I have to thank again all the industry for just making this happen here, because without the financial support, this wasn't so easy to do, or wouldn't never have happened. So thank you, and see you next year.